Hello to anyone giving this video a watch. If you're watching this, you're most likely either currently experiencing recovery from a concussion, have someone in your care with a concussion, or looking for some more general understanding. One of the primary reasons I wanted to put this down in a video format is for you to take this information at whatever speed is easiest for you to digest, pausing and rewinding when necessary to listen in chunks. And I hope that having this as a tool to refer back to helps limit any feelings of anxiety or being overwhelmed and helps you understand the condition a little bit more and giving you the confidence to move forward with treatment and self-care. So what is a concussion? A concussion is caused from a traumatic injury, but I do think it's important for you to understand or makes it a little easier for you to understand it if it's not just the injury itself, but rather a series of processes in your body in response to this. Right? Including your metabolism, your endocrine system, so it affects your hormones, your nervous system, and we'll cover these in the other slides, but I do think that's important to say just at the start so you understand and categorize it more as what happens in your brain in response to the head trauma as opposed to the head trauma itself. Okay. In this first slide, just a picture with these what are called concussion trajectories or tracts. Oftentimes, this is a way that concussions are presented and then categorized to help guide treatment. Okay, this slide references the most common presentations, and note that oftentimes these symptom umbrellas, these tracts or trajectories, they'll overlap. So while you may have some inner ear issues, so that vestibular tract leading to dizziness, or you may have more pain in your neck, or maybe you're experiencing a lot of cognitive fatigue, right? The biggest takeaway from this slide for you should just be that not all concussions are the same, and the recovery may not look the same between person to person. So if you know someone with a concussion, they might be presenting differently, and they will have a different recovery, both in what they're doing and timeline than you. Okay, so the next slide here, to understand concussions and how they work. Right. So like we talked about, it's more of a metabolic issue than a structural issue. It's more the processes that happen after the injury rather than the injury itself. And there are oftentimes different areas of the brain, neck that are affected structurally, but they're not the primary response of a concussion. The primary issue comes from an energy deficit that comes from those systems being affected. Following the head trauma, there's a decreased amount of cerebral blood flow, leading to up to a 50% decrease in oxygen with blood flow to the brain. There's also, at the same time, at the cellular level, a decrease in your body's ability to create ATP, which can more simply be thought of as the energy that your body uses to function. Right? So you have decreased oxygen needed for certain activities and functions and recovery, and you have decreased energy to perform these activities, and then you kind of create this energy crisis where one system that's typically meant to help boost the other isn't available. So there's no energy for glucose metabolism, there's no oxygen going for blood flow to these areas. It's ultimately you end up in this stage, and typically this is the primary reason for cognitive fatigue. But biggest takeaway from this is everything after concussion is going to take a little bit more from your body to perform. It's always going to cost a little bit more and be a little bit harder to do. All right, so this next slide. So what do you do now that okay, I understand it's not just the structural damage, that there's also processes happening. What do I do about it? Well, first, review the red flags on the next slide to make sure there isn't a case of an emergency. But the most important factor in this stage, if you've passed that and you're probably watching this video, you're probably not in that emergency scenario. The most important factor to keep in stage of recovery is safety. So everything I'm about to say, keep in mind that you may have an altered response from that sympathetic nervous system being affected that we discussed. So your heart rate and blood pressure might change. Because of the hormone levels might change in your body following a concussion, and monitoring the way that your body responds to different things will be kind of increase the importance of working initially with a healthcare professional, or at the very least having someone with you to monitor vitals and things and make sure you're safe when you're trying to get back to normal. If all emergencies are avoided and you're safely recovering, remember what we discussed in those previous slides, that your brain isn't getting the oxygen that it needs. For it to recover optimally, a safe subthreshold aerobic activity can help expedite recovery. So the research has shown by going away from just sitting in a dark room and initiating aerobic activity to bring that oxygen to the brain, you're going to have a decreased recovery time and better outcomes following your recovery. So what do I mean by subthreshold? Subthreshold basically just means that the activity does not provoke or worsen your symptoms. In the earliest stages, minor symptom provocation is okay, so like the first couple days. But if this activity, if you're a week in and you're starting your return to play, or you're trying to get back to whatever activities you were doing before the concussion, if you start going on a jog and then that creates symptoms, I would not progress anything past that. You want to improve sub-threshold levels. If your activity comes from going on a walk, stationary bike, don't perform these alone, and make sure that you're performing them in an area where you need to stop if you can. No jogs on the greenway or anything where you're going to be stuck if you have to stop. Again, safety is the most important part of this early stage. It also is going to be important to remember what I mean by light activity, right? And I feel like anyone that says, light aerobic activity will help with recovery from a concussion, light activity is different from person to person. So just keep that in mind. If you're used to running a lot more than the average person, what's light activity to you? Probably going to be more than the light activity you need to be doing in this stage. I've had some patients who have come in who have abnormal responses in heart rate and blood pressure leading to symptoms just from going from sitting to standing, or maybe walking at a casual pace for 5 or 6 minutes, right? So what this constitutes as what's enough for me to do might be easier to determine after seeing a healthcare professional who can measure this for you and keep track of these things, and then give you a guideline to start recovering at a safe pace. But if you don't have access to that, you don't want to go forward with that, the best advice I can say is working with someone else who can monitor you, starting in a very contained area, and only doing enough walking or whatever it's going to do to not produce or increase your symptoms. On the next slide here are the red flags that I described before. If you or anyone else has a concussion has any of these, it can indicate a much more serious injury. At that point, please go to the hospital. And on this next slide, it has pictures for 3 of those presentations on the last slide. These are the ones that indicate more skull fracture. Again, see any of these, right to the hospital. That halo sign, that one with the square, that's mostly just you putting some gauze into your ear. You have a little bit of blood, and then there's yellow around it. That yellow is cerebral spinal fluid. So that will be a strong, either go to the hospital right then or have 911, have an ambulance get you. Don't drive yourself to the hospital if you have that, but have someone drive you. Okay, next slide here, moving on to the different tracks and trajectories, starting with the vestibular system, right, which simply refers to your inner ear, which is primarily helping your body with balance. It's common for the inner ear to be affected from a concussion, which can result in dizziness, blurred vision, balance deficits, and several signs you may see or hear about include oscillopsia, or blurred vision with head movement, nystagmus, which is kind of a quick beating of the eyes, which can be associated with dizziness, and sometimes a sensation of the room spinning. Saccades, or jumping of the eyes, as it essentially plays catch up with a visual target, so you'll be visually tracking and your eye will kind of jump instead of being smooth as it watches. And then vertigo, so positional vertigo, or BPPV, is not happening with every concussion. It's not very common, but can happen. And unlike normal cases of BPPV, it's more common after a concussion or a trauma to have it in both ears or bilaterally. Normally, people usually experience one ear. Concussions are at a higher rate where if you do have BPPV, you'll probably experience it in both ears. Treatment for hypofunction will initially begin with varying degrees of hypofunction just being one ear's affected, the inner ear, and it's causing some of that dizziness or that blurred vision with head movement. Treatment will begin with varying degrees of head movement. So you'll see people doing this number to a metronome, focusing, maybe doing their smooth pursuits with their eyes, and begin in static and progressing to more dynamic conditions, which might be, okay, now you're seated. Now we're going to do it while standing. Now we're going to do it while standing on a foam pad. Now we're going to do it standing while walking. Now we're going to move and interact with different objects in the room and slowly progress it to be more functional. Whereas for the positional vertigo, treatment will be almost exclusively repositioning maneuvers. Your neck is also frequently affected during a concussion, and you may experience neck pain and spasm as a result. However, your neck may also contribute to your headaches or dizziness due to irritation of the receptors in your muscles, joints, and joint capsules, and the ligaments in your neck, responsible for communicating with the brain about your head's position in space and reacting to different tensions and pressures. This is called cervicogenic dizziness or cervicogenic headaches, and it will often present in a way that makes it feel like your head is very heavy or wobbly, like you have to rest your head in your hands or use the back of your chair to keep yourself up. Treatment for both the neck pain and cervicogenic dizziness will be very similar to physical therapy you would have for any other neck pain, focusing on pain relief, massage, strengthening, and mobility. The ocular tract here just refers to symptoms you may experience in regards to your vision or eye's ability to focus. You may notice a lot of frontal headaches or eye strain with this presentation, as well as light sensitivity or reading difficulty. You may have blurred vision, tracking objects, sometimes either coming closer or further away, which is more related to convergence and divergence or accommodation, where your eyes focus on one object, making it look like one image. Oh, lost my place there. I include these terms all in here just to help you, and maybe like with Google searches so you can look them up for yourselves. But I don't obviously need you to know what optokinetic reflex is. Just know that sometimes when objects are moving across your visual field, your body has a reflex to prevent that from looking too blurry, and it will kind of reset. So imagine a train going by you, right? Your eyes will follow a train car, reset, follow, to keep the image clear. This is your optokinetic reflex, and sometimes this can be affected in this track as well, resulting in blurred vision and dizziness as well. If you see this, the most common sign that people have nowadays with this is scrolling on their phone. So the images from their phone are scrolling too fast, and it's even more blurry than it normally would be, and people get kind of dizzy and get that eye strain in response. Treatment for the ocular tract with concussions will usually include varying degrees of eye tracking and accommodation and convergence, progressing again similar to the vestibular one from more static to eventually dynamic targets and backgrounds, and then progressing to whatever you may need for your activities of daily living or a sport that you're returning to. Cognitive fatigue is very common in patients with concussions, which most often comes from the energy crisis we described before, or affecting the hormone levels, but also plays a role in several bodily systems at play, right? Creating regular sleep habits is very important to help recover with this specific tract. And if you notice difficulty multitasking or performing tasks that have multiple bits of coordination at the same time, for example, like swinging a baseball bat, having to track the ball, have the movement, make contact, all that at once, that's a very complex movement. You may benefit from something like this, starting with the big goal in mind and working backwards and compartmentalizing different movements and getting them down, and then building up to something a little bit more functional. For the sleep hygiene, highly recommend starting to go to bed at the same time every day as best you can, waking up around the same time best you can, and avoiding naps. You're essentially going to have like jet lag after a concussion where your circadian rhythm is affected. The more naps you take, the harder it is to kind of reset that rhythm and get back to a regular schedule. Migraines are also common following concussions and are typically tied to the vestibular system, but they can happen without your inner ear being affected, so I give it its own little category here. Biggest things here, limiting activity because you're going to be very motion intolerant. When you do this, just touch symptoms. If you power through symptoms with other treatment, you're going to be uncomfortable, but with this in particular, it may cause a migraine. So I have listed on here a couple different triggers, dietary triggers that are most common to stay away from, and promoting hydration is going to be very important for preventing some of these migraines. All right. For the anxiety tract, aside from anxiety, you might just feel having to try and keep track of all of this information. You may also have a heightened anxiety or uncontrollable changes in mood following a concussion as well. Recognize that while this is frustrating, it's also very common and normal after a concussion. And communication with the appropriate healthcare provider is going to be important when managing your recovery. At home, try and utilize memory aids and reduce distractions to prevent exacerbating some of these heightened emotions. And remember that it's okay to take a breath and take your time with recovery. In regards to nutrition, there's still more emerging research for some of the supplements that listed below, but there's not really a lot of good research in humans yet. A lot of this information is more taken from animal studies or information we already know about higher level traumatic brain injury. Right? Keep in mind the first 2 weeks are when your metabolism is going to be the most affected or have the highest dysfunction. It's going to be the most effective for the supplementation, but don't rush. Still communicate with your physician and the appropriate healthcare providers in what to take safely. Don't just take these supplements. Remember, you're an individual, and some of these may be more appropriate for you as opposed to someone else. Make sure you're doing this safely. And finally, on here, hydration is a key factor of recovery. Many of us have trouble staying hydrated, but specifically after a concussion, it's been found that dehydration can lead to an increase in biomarkers and inflammation in the brain, which is tied to slowed recovery. So the easiest takeaway from this entire presentation, stay hydrated. I know this is a lot of information, but I hope having this recorded for you to reference on your own time and use to prepare before speaking to the appropriate provider will help you understand your condition, or perhaps if your family member has one, understanding their condition as well, and help you along your way to recovery. If you have any questions, please consult your doctor or appropriate healthcare provider and make sure that you are promoting a safe recovery.